The American Cancer Society says that colon cancer is the third most common cancer among men and women in the U.S. As part of Colon Cancer Awareness Month, Dr. Brent Wallis from People's Health joins us to explain how you can help prevent colon cancer. Dr. Wallis, good morning to you. I mean, it's easy to detect, right?
Yeah, it's extremely easy to detect. In fact, one of the most highly detectable cancers that there is, and the thing that's so important to remember is that if you detect it early, it's completely preventable. About 90% of colon cancers can be avoided if you just identify them early. And it's concerning because we're seeing such a decline in the screening rates.
What do you think's going on there?
Yeah, I mean, I think there's a couple of things that have happened. Obviously, the pandemic had a great effect on screening. A lot of people were either unable or unwilling to go in and get some of their screening tests done. So we're still trying to catch up from that. But I think there's a lot of, a lot of fear about some of the testing and a lot of misunderstanding. There are a lot of tests that are quite easy to do that can detect this cancer early.
And I must tell you, I'm a little surprised that this is still number 3 as cancers go, because I mean, we were talking in the break. I remember being, in my mid to early 20s, seeing a network news report about this revolutionary idea that they would put a tiny camera, down into your system, and how crazy that seemed at the time. But here we are 40 years later, and people just simply aren't taking advantage of this technology.
Yeah, I think a lot of it is awareness. That's why we try to talk about it a lot. The U.S. Preventative Task Force actually just lowered the recommended screening age as well down to 45. So a lot of people don't realize they hit 45. Previously it was 50. They think, oh, I'll get around to it at some point, and they just never do. And then unfortunately, they're found to have a major cancer. So it's something you really have to talk to your doctor about.
And it's, I mean, I have a loved one who recently had this, and fortunately they were fine, but there are cases too of people who you'll get a little polyp and they tell you to come back, or they'll take it out, and it's really they knock you out. There's nothing to it. Then you get to eat anything you want afterwards. Is there a stigma associated with this?
I'm sorry?
Is there a stigma associated with it?
Not so much a stigma. I think it's a fear and maybe a little bit of a misunderstanding. People are afraid of the test. The test is actually quite simple, can be done in a day. There are even some home-based testing kits that you can do as well. So again, it's important to talk to your doctor about what your options are. If you're scared of colonoscopy in particular, there may be another screening you can do to check for the cancer.
All right. Well, we've talked about the risk factors over the years, those sorts of things, so I wanted to kind of cover some of this other stuff. Get your colon cancer test, however you choose to do it, is the message from Dr. Brent Wallis from People's Health.
Thanks, John. You have a great weekend.
And you too. Thank you, Dr. Wallis.